Good afternoon. I'm very happy to be here in this so interesting conference. I had the opportunity to attend it from the beginning. I would like to thank the organizers for inviting the Joint Research Center in this conference because the work we are doing is really very relevant to what has been presented already, and we will be really happy to present the way we work and try to somehow work at a European level in making sure that there is an ecosystem that really is diverse, that is sustainable, and allows also countries to talk to each other and learn from each other. So for those ones that are not very familiar with the Joint Research Center, I thought of just having a very short presentation. So the Joint Research Center is the Science and Knowledge Service of the Commission. We are a Directorate General in the Commission. We have also a board of member states governors that we consult for our strategy. We are the scientific arm of the European Commission. We're having over 2,000 researchers across 6 different sites in Europe. That we work in a very diverse way. So we have almost, if not all the disciplines working together in a kind of project-based perspective. And we, of course, have many publications in scientific journals. So how we work, the Joint Research Centers, as you can see from the mission statement, provides independent evidence-based knowledge and science supporting EU policies to positively impact society. I would like to underline the last words. The whole approach is to ensure that the best policies are actually decided for societies and to ensure that what we can deliver is really informed by the relevant evidence. So the usual narrative on science for policy, I would say, is more like science for democracy. It's ensuring that the best decisions are made according to the evidence is there, because there's a huge impact on European citizens, of course. And we work in 3 different ways, as you can see here. First, with an anticipatory mindset, meaning that we are trying to look ahead. We are trying to anticipate what are the key challenges. So we are actually prepared to the best possible extent. That's why we have strong foresight teams. Of course, you cannot predict the future, but you can work with the evidence you have and see what the future scenarios might be and be prepared. That's a way of working that we can call a proactive way. But we also work in a reactive way, so we're trying to respond to current challenges and to current problems in societies. So we try to connect the dots. We're trying to work across different policy areas, integrating insights from the science that is produced in JRC, but not only in JRC, because of course science does not have any borders. So also engage with a broader academic and research community, but also with policymakers to understand the policy challenges, the policy perspectives, because the main role of the Joint Research Center is somehow to translate evidence to concise and comprehensible policy outputs that can really have an impact on the policy-making perspective. So it's not just producing research. That's, of course, one part of our work, but it's also what we say knowledge management to ensure that this scientific work can really find an input to the policy-making process. And, of course, the third pillar is impact. We also work in measuring the impact of policies, which is a necessary tool. It is a necessary approach in order to inform the new policy cycle, the design of new policies. Because as it's been shown already from all the other speakers, there is a policy cycle, but of course it's not always followed in this sense that it's always ongoing. So the evaluation process ensures that the impact of policies has taken place. We can see perhaps weaknesses, we can see the reactions, we can see how has been implemented, and we can really learn for the next stage. And we work in different ways in terms of different entities. So these are the knowledge centers that are virtual entities that bring together knowledge on specific topics. So in this sense, we ensure that different disciplines and colleagues coming from different research areas can work together to provide a holistic view of a problem, making sure that we do have all the aspects integrated in the research we're doing. Because JRC is in nature an interdisciplinary and multidisciplinary research center, and because we all know that any policy area, and of course, in some of the cases, research area requires more than one discipline to understand all the different aspects. The knowledge centers are complemented by the competence centers, which, as you can see here, there are a number of them, that aim to provide the tools, the frameworks for scientists, also for policymakers to work on these topics that you can see here. For example, the one we have on participatory and deliberative democracy resides in ISPRA, provides all the different tools, all the different examples of citizens' participation, and recently they have developed also a training on how you engage citizens that is delivered to public administrations across Europe. And this is how the three different pillars that I have already mentioned to you, the three different way of working, support and underpin the full EU policy cycle. I think it has become clear from the previous talks that evidence does not really come only at the stage that you have identified a problem and you're trying to look for the potential policy options. Actually, the most critical part, in my opinion, is when you're trying to identify the problem itself. So that means that at the agenda setting, at the priorities, it's important to have the evidence to form a policy question, to understand the problem in its depth, but also in its different aspects. So you are sure, of course, to the best possible extent, that you have really captured the problem in all its dimensions. I'm saying that because usually the discourse about evidence-informed policymaking comes when somebody understands there is a problem. We need to see what the evidence says and understand the policy options. So this is how we work at the priorities and planning with anticipation, as I said, future policy initiatives, foresight teams, horizon scanning, at the integration, where we try to build the links between different policy and scientific areas, and at the consultation, and of course, we work with impact assessments to try to understand impact, but also when the policies are actually implemented, try to evaluate the impact, which then allows us to support the next stage of the policy cycle. I know this is a very busy slide, and I don't really aim to go through each one of them. So we work with the research portfolio. So these are entities that try to connect the expertise from different parts of JRC. So colleagues work in diverse disciplines in order to respond to these particular questions, if you want to say, to these particular umbrella topics. And you see there are 25 research portfolios that allow colleagues to work in an interdisciplinary and multidisciplinary way. And these are some of the portfolios I will be actually talking about, drawing my work today. One is for innovation for democracy and public governance. This is mainly the portfolio I'm working in my unit that supports democracy and public administration and governance and reforms that need to take place to ensure that democratic values are really there. And this is the foresight, the support to science and innovative policy making. So how we can really engage in innovative policy making and tools that can really improve also the efficiency of public administration. So this is a part of the talk that I have tried to engage with colleagues in JRC working on health-related issues to bring you some of the wealth of research that is done in JRC. I'm not a health specialist, so I cannot really go in deep into that. So you will find, if the presentations are shared, the relevant contact point for health specialists if you would like to engage with my colleagues and really go into deep on what the research has been doing. So among the portfolios that I've showed you, those are the ones that are really related to some of the issues that we're trying to address in health perspectives. This is the one, the blueprints for a strong European health union. What you see on the left hand is the Directorate Generals we cooperate, and this is how the priorities of the Commission are really kind of linked to the portfolio. The other one is about societal resilience, systemic disruptive events and risks. And this is, again, how the structure works. I will go a bit into more details on what is the main approach. So the One Health is not a niche concept, but it's an operating system that is trying to ensure that we respond to intersecting crises of our time in a way that it's not a fragmented way. So One Health connects human, animal, environmental health for a resilient future, and we're trying to shift, from a fragmented one-to-one response to a kind of unified strategy. And of course, in achieving this purpose, science is critical to the success of this approach because as I said already, it provides us the basis to understand this complexity, the relationships, and make sure that we can really drive innovation in areas like disease prevention and treatment. So in that way, we can develop more effective solutions and sustainable solutions for health challenges, and we can also better anticipate, perhaps, and prepare for emerging health threats, reduce the risk, hopefully, for pandemics, and protect biodiversity. And these are some of the pillars, support mental health, and ensure that whatever we can deliver is really something that is evidence-based and the best possible evidence we have, because we also know that the evidence needs to correspond to the high-quality criteria and to all the standards of research integrity. That in terms of the main objectives about health research in JRC, I've tried to summarize them. I'm not sure I'm doing justice to the amazing work that the colleagues are doing, but I think that's at the kind of cornerstone. So support public health and well-being policies, support the implementation of Europe's Beating Cancer Plan. There has been a lot of focus on that. Improve disease prevention and care through guidelines. Provide harmonized data. I've heard from the previous speakers that that's one of the problems we have in most of the cases, to ensure that we have access to data, and also data at a Europe-wide level, because that's important to have a comparative approach. That's something we try to work on. And inform the current health policy agenda, help to improve disease diagnosis and support research. So you can go to, I will provide all the links for people that are really specialists or very much interested in the specifics of health research and see the work that has been done in our labs, but also with engagement with externals and member states. Because as I say, I think what really is beneficial when we're trying to work in JRC is the fact that we work with member states, we work with externals. We are a kind of research hub for the whole Europe, hopefully engaging with all the different strands of work, although that's, of course, a challenging work because it requires a very good coordination and making sure that people reach out to us, but we also reach out to the others. The main part of the talk, as has been discussed with the organizers, and the focus is on a topic that has been already touched from other colleagues, the capacity building, because I think there has been already quite a great focus on how institutions should interact, how we should build an institutional infrastructure that can support evidence-informed policy making. And that is very important on the organizational level. But it's also very important to think that behind any kind of structure, behind any kind of process, there are people. So these people need to have the capacity to work on this interface, which is itself challenging. Because as we have seen, it brings different, let's say, different professions together. It brings professionals that also come from a different background. So to establish this connection and dialogue is very different. So we try to identify the skills and mindset that needs to be there in evidence-informed policy making. And we work in an ecosystem approach, which means we try to identify processes, organizations, principles, and actors. And all of them need to be there if we want to have a system that can really work, a functional one. We also need to understand the limits, so that's why we talk about evidence-informed policymaking and not evidence-based policymaking. That's one of the inputs that policymakers receive, but it's not a technocratic process. I would like to underline that. It should be a democratic process. That's the way it should be, because it's also like not only evidence that is on the table, it's a citizen's perspective, it's administrative data. We need to assess the social and economic impact. It's not just the evidence on the table of policymakers and all the problems unresolved. There are different factors that need to be taken into account. And of course, citizens' perspective, I think it's been already mentioned, is an important factor. So we have tried to work on the science behind science for policy, try to see which are the relevant skills that really allow scientists and policymakers to work on this interface. And this is why we have developed 2 competence frameworks, one for researchers working on science for policy that has 5 pillars, 5 clusters that are broken down to specific skills. That seems quite a busy visual. And just to clarify, not everyone is expected to have all these different competencies. So it's a model, it's a map that identifies the relevant skills, competencies, and knowledge. And speaking for myself, moving from academia to knowledge broker, more or less, organization, no more or less, this is the knowledge broker organization. It's another set of skills that you need to have and develop to work on this interface as a kind of evidence connector, evidence translator. This is the one for policymakers. It's a bit more demanding, as you can see. Some of the clusters are common, so the one for collaboration, communication, and engagement. That's on purpose because the 2 competence frameworks build on each other. And it's expected that some of the clusters, of course, in a different way, are common to the 2 different competence frameworks. We have placed a particular emphasis on the 3rd cluster and work with evidence. And we have developed a relevant training for that. Because we believe, and I think it was also mentioned in the previous talks, that it's not only evidence that needs to be there, people need to be able to work with evidence, understand the scientific mindset, and be able also to identify what is relevant evidence and also credible evidence. So this is how this specific model is broken down to clusters. So it's much more analytical, as you can see. It's a full publication you can access online. I don't have the time to go through that, but all our publications are fully accessible online. And there is also a Smart for Policy tool, which is a tool that is online, accessible to everyone, that really allows people to go through a set of questions based on the competence framework, reflect on their strengths and weaknesses, and receive a report on how they feel. I mean, how is their competence evolves in specific clusters. It is a self-assessment for the moment, but we aim to open the team perspective, the team perspective in 2026, which means that a group leader can really invite other colleagues to go through this competence framework and this Smart for Policy too. And then, for example, in a unit, you can get aggregated, anonymized results on which are the strengths of the team on particular, let's say, competencies. That means that is a very good for training needs analysis, so you can identify the weaknesses and strengths. It's a curriculum development tool and a learning and development tool. And again, it's not only for the EU, it's for everyone as soon as you have an EU account. And some other actions we have developed, or these are links. So we have a community of professionals because we need to strengthen, again, the connection between policymakers and scientists. We have blog posts, relevant publications, because we're doing also research, we're researchers. We have a training for scientists and policymakers. Why? Because usually the discourse is that scientists do not communicate in an efficient way. It's not only them, it's also policymakers that need to be able to understand science. And the training for policymakers we will speak about a bit later. And what you have seen is not only a kind of, let's say, internal initiative in the Commission, which is already working under the Better Regulation framework, but we're also working with member states. So Leonardo has already mentioned the project we're working. I will explain a bit further. So the evidence-informed policymaking, I don't need to go through that. It's a framework, it's a set of principles, and as I said, it's not a technical matter. That means that each country we're working on has its own context, has its own specificities, and this is the wealth of Europe. That also means that there's no model, one model that really fits all the countries. Each country has its own framework, and that needs to be respected. So these are some of our, let's say, kind of guiding principles we work on. Again, it's not just a technocratic process. It's something that really brings legitimacy and trust in democracies. And that's an important element that we should underline And again, it's not that only policymakers need to have the evidence to somehow, let's say, explain why this policy has been adopted, perhaps instead of something else. It's also for citizens to understand why this policy option has been prioritized over another one and have access to this data. So that speaks to principles of transparency, accountability, and how you actually trust as citizens the policymaking process. So that's our concept moves from single elements, so understanding all these different parts I have already explained to you, how national systems, ecosystems work, and the fact that we need to build a European ecosystem. So we need to also have these exchanges between countries and learning procedures that really benefit. So what we have done, it's not a promise, we have implemented it. There has been a first technical support instrument from 2022 to 2025 with this title, Building Capacity for Evidence-Informed Policymaking. That has finished in March 2025. The funding came from SecGen reform, and we were implementing it with OECD, and my colleague Stefan is here that will follow up on my talk. The beneficiaries were actually a blend between government, centers, ministries, and also research institutes or universities, because we need to bring these two sides together to talk to each other. So we had 7 countries, as you can see. So we had Belgium, Netherlands, Estonia, Lithuania, Latvia, Greece, and Czech Republic working on this project. We had specific country-level analysis that was also complemented with cross-country learning exercises where we were bringing countries together, either in capacity-building workshops or in mutual learning exercises. That's the second one. We have started officially, in September 2025 with a kickoff that has taken place in Brussels. That was going to be, again, a 30 months project. We'll have another set of 7 countries, very diverse, coming also from different parts of Europe. So Spain, which is the Linty country, Portugal, Ireland, has already been mentioned, Belgium, France, Poland, and Cyprus. These projects have a strong learning and development angle, so they have capacity building workshops for scientists and policymakers. As I said, they have mutual learning exercises on timely topics. The last time we had on policy evaluation and the use of AI in evidence-informed policymaking, which is a huge challenge. I don't think has been mentioned to a great extent today, but it has already imposed challenges to knowledge acquisition, knowledge management. It will impose further challenges, I guess. And we work like with the capacity building. Of course, we cannot train the whole country, right? So we are trying to train some people that they can really deliver these trainings to their own national context. And this is the last slide. I hope I'm not exceeding very much my time. OK, good. Some remarks. There are many remarks. There are, for this first project, you can find all the country-relevant reports online. They are published. And soon there's going to be a report also overall for the project. There is a reflection paper from the JRC gathering the main insights as the JRC has analyzed them. But in general, focusing mainly on the learning development activities, I would say that it has become evident. We are talking all day about evidence-informed policymaking, but still there was not, or there's still not, a common language about it. So how people understand evidence seems to be also different in different countries. Some countries focus on data. Some countries have a more like open approach. It depends. So the conceptual clarification is important to establish this common ground. The learning about the science and evidence-informed policymaking cannot be only PowerPoint presentation, has to be hands-on exercises. So it involves also with workshops that participants really have an interactive role. And what we have also understood, the capacity building workshops on policymakers were delivered with OECD. We have realized also by talking to people, because that's not a one-way flow of communication, it's a two-way, that you need to, whatever you present on evidence-informed policymaking, to ensure that it has an impact on policymaking, to make sure that there is really a connection with the workflow of everyday work of policymakers. So it's not a kind of a distant, abstract concept, which is nice to have, but is essential to have while you work every day. And the individual learning is important, so somebody, of course, needs to have the space and the time to integrate all that, but it's important to work also with group exercises. We have seen that also working as a group of policymakers coming from the same country was sometimes really challenging, so because ministries tend to have different approaches, but also working with groups with a diverse set of participants from different countries was also very challenging, but also productive because countries were looking for a peer learning process. So the fact that countries could learn from each other was very much appreciated. We could see common challenges. Of course, there were different approaches, but then any kind of solution has to be context relevant. And the last point is that cross-country perspectives are very important. Again, each country's infrastructure, research, and political setup needs to be respected. Common, let's say, approaches are really important, but the context is equally a critical factor, and we really need to understand that. But there are also very good practices that countries can use to learn from each other and has been really evaluated. I can really speak for hours about that, but of course, I will respect my time here. I will be happy to share further links or work we are doing and participate in the panel that comes after the talk. Thanks a lot.